Cardiovascular disease can be deadly for anyone. But people assigned female at birth face unique risks, largely due to differences in anatomy and hormones. They're more likely to have other heart attack symptoms along with chest pain, and they have a higher chance of developing symptoms from heart failure. Heart-healthy lifestyle changes can help. What is cardiovascular disease in women? CVD affects women in unique ways. Sex-specific differences like anatomy, red blood cell count and hormones seem to impact a person's risk factors, symptoms and other aspects of their cardiovascular health. How is the cardiovascular system different in women versus men? Researchers have found many sex-specific differences in the cardiovascular system. These complex differences, often at a microscopic level, can affect how women experience heart disease compared to men. A few examples include anatomy. Women have smaller blood vessels and heart chambers. The walls of their ventricles, pumping chambers, are also thinner. Blood count. Women have fewer red blood cells. As a result, they can't take in or carry as much oxygen at any given time. Hormones. Estrogen and progesterone levels are typically higher in women, while testosterone is higher in men. These hormones can impact many aspects of your heart health and overall health. How does a woman know she has heart disease? Women usually develop symptoms of cardiovascular disease about 10 years later than men. Many causes and symptoms are the same regardless of your sex assigned at birth. But there are some important sex-based differences you should know about, specifically in relation to heart attacks and heart failure. Symptoms of a heart attack in women. Chest pain or discomfort is the most common symptom for everyone. But women are more likely to have some other type of symptom, in addition to chest pain, or instead of it. Also, they're at a high risk of having a silent heart attack. This is a heart attack that goes unrecognized as being a heart attack. Women over age 65 are more likely to die from a silent heart attack. Women have reported many different kinds of symptoms. They may feel pain or discomfort. In their chest, most common. Left breast. Back or between their shoulder blades. Neck or throat. Jaw or teeth. Arms. Shoulders. Legs. Also have other symptoms like unusual fatigue. Shortness of breath. Feeling dizzy or faint. Feeling hot or flushed. Indigestion. Fast heart rate. Numbness in their hands or fingers. Nausea or vomiting. Loss of appetite. New vision problems. Headache. Coughing. Choking sensation. Many women have early warning signs before a heart attack. These are called prodromal symptoms, and they can happen hours, weeks or even many months before a heart attack. The most common early warning sign of a heart attack is unusual fatigue. In addition to fatigue, other early warning signs of a heart attack include feeling anxious, frequent indigestion, fast heart rate, change in thinking or remembering, feeling off or foggy, loss of appetite, trouble breathing at night, trouble sleeping, tingling in your hands or arms, numbness or burning in your hands or fingers, more frequent or more intense headaches, pain or discomfort in your chest, discomfort in your jaw or teeth, weakness or heaviness in your arms. These prodromal symptoms happen off and on, and they may go away on their own. Many people wait to call for help until the symptoms persist or someone notices something is wrong. But don't delay. Get help as soon as you notice any unusual symptoms. Heart failure in women. Heart failure is a chronic condition in which your heart can't pump blood as efficiently as it should. This condition causes fluid buildup in your body, sometimes leading to symptoms like swelling and weight gain, and usually gets worse over time. Heart failure affects women and men at similar rates. But causes, symptoms and other aspects of a person's experience may differ based on their sex. Here's what researchers know. Diastolic heart failure with preserved ejection fraction, is more common among women. Causes of heart failure in women include high blood pressure, hypertension, heart valve disease, diabetes and coronary artery disease. Hypertension and valve disease cause heart failure more often in women versus men. Coronary artery disease is the most common cause among men. Women usually develop symptoms at an older age and more commonly develop left bundle branch block, an irregular heart rhythm that can result from heart failure. What are the risk factors for heart disease in women? Traditional risk factors for heart disease, like high cholesterol and high blood pressure, affect everyone no matter their sex. However, researchers found that these risk factors have some sex-based differences. High cholesterol, hyperlipidemia, is a risk factor for heart disease that applies to everyone. A low level of HDL cholesterol, good cholesterol, may be more dangerous for people AFAB than for those AMAB age 65 and older. Diabetes mellitus, people AFAB with diabetes are 2 to 4 times more likely to develop cardiovascular disease compared to people AMAB with diabetes. High blood pressure, women over age 60 are more likely than men to have hypertension but less likely to have it managed. Sodium sensitivity. After menopause, your body is more sensitive to sodium. This means you need to restrict sodium in your diet even more than before to prevent your BP from going up. Menopause, estrogen helps reduce your risk of cardiovascular disease. But natural menopause or surgical removal of your ovaries causes your estrogen levels to drop. So, you face a higher risk of blood clots, atherosclerosis and high cholesterol. How can women prevent heart disease? Work with your provider to manage your blood pressure, cholesterol and blood sugar. This may involve taking medications. Make an exercise plan that works for you. Slowly work up to 150 minutes per week of moderate intensity exercise, like walking. Avoid tobacco products and limit alcohol. Follow a heart-healthy eating plan. When it comes to heart-healthy eating, remember these simple steps. Plan. Write down your dietary goals and get advice from a healthcare provider or dietitian. Write down all the foods you want to eat more often and those you want to reduce or eliminate. Choose recipes you like and map out your meals for the week. Make a list to take to the store and stick to that list. If you prefer takeout, make your own personal menu of heart-healthy options and only choose from those. Portion. Even healthier foods can become unhealthy in large quantities. Keep an eye on your portions. Following a heart-healthy diet can help reduce risk factors of heart disease, lowering blood pressure, improving cholesterol, reducing body weight, and lowering blood sugar. 1. Salmon and tuna. These fish are high in omega-3s healthy fats that can lower your blood pressure and reduce your risk of heart rhythm disorders. If you're a vegetarian, try tofu as an alternative. 2. Olive oil. This oil is rich in antioxidants that help protect your blood vessels. Replace saturated fats, like butter, with olive oil to lower your cholesterol. 3. Walnuts and almonds. A small handful of these nuts daily can lower your cholesterol and protect your heart's arteries from inflammation. Walnuts are also packed with omega-3s. 4. Oranges. This citrus fruit is filled with cholesterol-fighting fibers and potassium to help control or even lower your blood pressure. 5. Avocados. Avocados provide a great source of heart-healthy fats which lower your cholesterol and reduce your risk of heart disease. 6. Dark chocolate. Consuming dark chocolate in moderation can help boost your heart health and lower your risk of heart disease, stroke, and diabetes. Pick a dark chocolate that is at least 70% cocoa to get the benefits. 7. Low-fat yogurt. Dairy not only helps your bones stay strong, but also helps control your blood pressure. Low-fat options help boost calcium intake and minimize fat. 8. Cherries. Cherries contain an antioxidant that helps protect your blood vessels and reduce inflammation. 9. Dark leafy greens. Greens are packed with vitamins, minerals, and nitrates that help open blood vessels so oxygen-rich blood can reach your heart. Dark leafy greens include spinach, lettuce, arugula, bok choy, and mustard greens. 10. Black beans. Black beans are filled with antioxidants, folate, and magnesium that can help lower your blood pressure. Don't forget to rinse canned black beans to remove extra salt. Enjoy eating. A heart-healthy diet can and should be enjoyable. If you have risk factors for heart disease or a history of heart problems, you're not alone. More than 18 million adults in the US live with coronary artery disease. And every 40 seconds, someone has a heart attack. These numbers can be startling, but this knowledge also gives you the power to make changes. Research shows that 4 out of 5 heart disease cases can be prevented. Thank you for joining us on this important exploration of high blood pressure. If you found this video informative or if you have personal tips to share, don't hesitate to drop a comment below. Knowledge is power, and together, we can empower ourselves and others to prioritize heart health. Make sure to give this video a thumbs up, subscribe for more health insights, and hit the notification bell to stay updated on our latest content. Until next time, curiosity is knowledge, and most importantly, stay healthy.